work that I primarily do is around understanding variation in care that's delivered for patients undergoing cardiac surgery, looking at where there's differences in care across hospitals or providers, understanding the sources or the reasons for that variation, and then how that impacts things like outcomes and episode spending. In addition to that, the work that I do is very much focused on how health policy and regulations impacts the care that is provided, and how those may have intended and unintended effects on patients. There's a lot of opportunity as it pertains to improving value in the healthcare system. This has been a hot topic for a number of years, especially in the last couple of years with value-based payment initiatives. We certainly have spent a lot of time trying to improve quality of care, ensuring good patient outcomes, but I think that is only one side of the coin. And other things that we should really need to consider is what is the efficiency of the care that we're providing. And the other aspect I think that is often less discussed when it comes to value is whether or not the care is being applied appropriately. Oftentimes we are very concerned about how can we perform a surgery and outpatient care in a very high quality executed way, but if it's not being executed on patients appropriately, then that is very low value care. So we need to think about, is this what the patient wants? And is this, from a clinical standpoint, is it appropriate for a patient to receive a certain procedure or drug? So balancing the incentives that are placed on trying to reduce things like hospitalizations and what that means for patient outcomes is one thing that's on the front burner for a lot of people. There's a lot of evidence that high episode spending is related to increased use of post-acute care, skilled nursing facilities, inpatient rehab. And while these may be beneficial for some people, they may not be beneficial for everybody. And so understanding how do we balance who are the patients that benefit most from these kind of services, and then avoiding that kind of healthcare use for patients that may not need it and may have better outcomes by avoiding those types of care. One thing that we've been looking at in terms of disparities is the kind of advancement and diffusion of new cardiovascular technologies. So every year we see new medications or devices be rolled out. We've been trying to understand how those technologies kind of diffuse across the population and whether certain populations have limited access compared to others, and trying to ensure that the patients that has been expanded to are also maintaining high quality of care. And while those are important from a research standpoint, it's also very important from a regulatory standpoint. And how do we inform the policies that regulate where these devices can be supplied, where we can try to expand access in a safe and equitable way, I think is an area of increased interest, particularly in the cardiovascular space.